Hello, my name is Kate Faulk, and this is my presentation for my exercise and sports psychology class on behavior change and exercise. Throughout this presentation, I will be covering the following objectives. I will be answering the question of what is behavior in terms of exercise and health, as well as giving definitions of these terms. Also, I will be giving the advantages of being physically active in order to promote a behavior change, as well as giving some statistics found in case studies to back these advantages. Also, I will be introducing as well as briefly giving descriptions of two of the most frequently used models to interpret behaviors. These two models will be the trans-theoretical model as well as the health belief model. Lastly, I will be answering the question of how is exercise being encouraged. To answer the first question on our objectives list as to what behavior is in terms of health and exercise, we could see that health behavior is a combination of things that we learn, things that we do, and the way that we react to these things that help to motivate our actions of wanting to live a healthier life, both physically and emotionally. Through the many research articles that I read over, I could see that there was a direct correlation between having a higher knowledge of health benefits and having a positive health behavior. A lot of the times, those who have a higher knowledge know the benefits and are able to set better goals in order to promote their healthy behaviors and lifestyle. I believe that the article Health Literacy and Public Health said it best when they said that health education in correlation to health behavior must be seen as a step function with a threshold effect rather than in a simple linear fashion. We will see this quote here be brought to life in a few slides when we talk about the trans-theoretical theory and the steps that one must take in order to go through the theory. Some advantages of being physically active to promote a behavior change are that studies have shown that being in a sedentary behavior or being physically inactive was actually found to be directly correlated to a much higher chance of depressive-like states or other negative type attitudes. We see this happen a lot in the older generation when they get to the point where they're not able to be as physically active as they once were, and they kind of fall into this emotional state of negativity because they feel like they have nothing that they can do or that they don't belong. This also happens a lot in athletics when there is an injured athlete who really just wants to be a part of the team and be in practice, and you're having to hold them out. They can sometimes start to sink into these depressive-like states or negative type attitudes because they almost feel helpless. So within these two examples, a major key to keep these people out of depressive-like states or having heightened negative type attitudes is to find new ways to get them involved or to keep them physically active without further injuring themselves or pushing way past their threshold limits. Another advantage that I found within researching is that being physically active has shown to decrease the risk of death at a very young age. This could either be from diseases or emotional distress. The following are statistics found behind the advantages of being physically active to promote a behavior change. Being physically inactive has accounted for about 2 million deaths. It has become the fourth leading cause of death worldwide. According to the World Health Organization, also known as WHO, 22% of these 2 million deaths are due to cardiovascular diseases. Not always, but most often, cardiovascular diseases are from being obese or being unhealthy in your lifestyle, whether that be from being physically inactive or consuming the wrong foods. 10 to 16% of those 2 million deaths have shown to be associated with depression and other diseases. Of all the deaths that I have just spoken of, they all had one thing in common, and that was that they were all physically inactive. Due to these alarming numbers, we have seen a greater push for physical activity in all populations. The first model or theory that we will discuss is the trans-theoretical model, which was created by DeClement and Prochaska in the early 1970s. The model was created to give people an outline of steps to follow in order to get back on track for certain things. This model does a very good job of helping individuals to stay on task and not go back to old ways of sedentary life or negative lifestyles. Over the years, this model has been used for many issues involving any sort of addiction to an unhealthy lifestyle, problematic behavior. As of late, it has been used to promote change and encourage physical activity. Many psychologists, as well as their patients, favor this model because of its clear outline on the steps needed in order to get to where your end goal is, which we will see in the next few slides. The layout of the trans-theoretical model can be broken into the level of change, which we will discuss in the next slide into more detail, which involves pre-contemplation, contemplation, preparation, action, maintenance, and either relapse or termination. Next is change processes, followed by decisional balance, which in this state, it's the comprehended goals and what an individual sees as the benefits from staying on track and obtaining those goals. The last step is self-efficacy, which is the satisfaction of actually obtaining the goals. The level of change within the trans-theoretical model can be clearly seen in the image below. The diagram gives a clearer image to the quote that we introduced in the introduction, which stated that health education in correlation to health behavior must be seen as a step function within a threshold effect rather than a simple linear fashion. This step function can be seen with the circular motion and the arrows pointing to each level of change. The first level of change is the pre-contemplation level of change. Within this level, the individual is not yet ready for change, but they have at least been given the idea that maybe they should do some things in order to make a change. The second level of change is the contemplation level. Within this level, the individual takes the idea that they were given and actually starts thinking on their own about changing. Moving on to the third level, which is the preparation level of change. This is where an individual decides to actually make the change. They start to take very small and subtle steps in order to make their changes actually come into action, which leads us to the active level of change, which is our fourth level of change within the trans-theoretical model. Within this level, individuals take the idea and the thoughts that they processed in order to take action on the change that they want within their lifestyle or behaviors. The next step is the maintenance level of change. This level is when the new behaviors are actually adopted and individuals continue their changes while preventing relapses happening of their old behaviors or actions. After this level of maintenance, we are hoping that an individual would go to the termination stage, which termination is rarely hit, and most people live in a constant state of going through all the levels because they hit that relapse stage, which we hope no individual has to go through a relapse. Within the relapse stage, individuals end up returning to their old ways, and because this relapse is hit, they have to start way from the beginning in the pre-contemplation stage whenever they finally decide to try to go through the level of changes again. There are many arguments behind the trans-theoretical model that were brought to my attention while I was doing research. The main argument is that the model is based off of a perfect lifestyle, when we all know that a perfect lifestyle will never happen, especially in this day and age. It seems like everyone is always on a constant go, go, go. And whenever you try and throw in dieting, work, taking care of a family, being social, staying on top of schoolwork, working, and just day-to-day living, the complexity of all of these outlying factors tend to hinder the consistency of the model and what it attempts to do within behavior changes. Another argument is that the trans-theoretical model tends to sway people to only think of short-term goals rather than trying to put in long-term goals, when we all know that long-term goals are needed once all the steps of the trans-theoretical model are reached in order to live a healthy lifestyle and have a more positive behavior in the long run. A great example was found in Rothschild's article on public health and the social issue of behaviors within health, when he stated that exercise habits are required over a long period of time. This is due to continued learning and education about the benefits of exercise and positive behavior, as well as the motivation to continue on and a continued positive mindset, which these positive mindsets are most often brought on by not only the individual, but as well as the people that they surround themselves with. Rothschild felt like most models only help to get you to those short-term goals, just as the trans-theoretical model. So he felt like more models needed to be made that helped individuals to obtain not only short-term goals, but as well as long-term goals. Our second model is the health belief model, which was developed by a few psychologists who were all influenced by Kurt Lewin's theories. The model was actually originally created as a model to explain and predict preventative health behaviors. In 1952, one of the psychologists that developed the health belief model, Godfrey Hochbaum was his name, used the factors of the model in order to make the decision to obtain a chest x-ray for early detection of TB, which was very prevalent in those days. The model gives us an understanding to the various mood swings or attitude behaviors and the learning necessities or educational needs of individuals. The model is used to construct a proper process of intervention, just as the trans-theoretical model that we saw in earlier slides. They both give a step-by-step process on how to get to the end goal of termination. The health belief model did a great job of giving individuals hope that they would indeed obtain the changes that they needed in behavior if they would get through all the key components or steps within the model. If an individual were to get through all of the key components of the model, it was said that they would be able to obtain a very healthy lifestyle and have a more positive or non-problematic behavior. The next slide will outline the key components of the health belief model. The key components of the health belief model are as follows. Perceived susceptibility. This is an individual's outlook on the risk or chances of major health complications due to either an unhealthy way of life or having a negative behavior towards life. Next is perceived severity. This is questioning how serious an individual deems an unhealthy lifestyle and negative behavior to be. The third component is perceived benefit. This is the outlook of the pros or positives of living health consciously and keeping a positive mood and behavior. Up next is perceived barrier. This makes an individual question what's going to stand in my way and what do I need to do in order to get past these obstacles. The last component of the health belief model is self-efficacy. This is the satisfaction of an individual's end result whenever he sees that a goal is met. So if exercise has all of these positive effects on behavior and overall lifestyle, how can we get more individuals involved? This is where healthcare providers are coming together in order to create strategies to increase the exercise population. Some examples of these strategies are as follows. Advertisements is a big thing. We see advertisements everywhere all day. whether you're on social media, in the car listening to the radio, or at home watching TV. Advertisements are everywhere. When trying to increase the exercise populations, we'll see that fitness centers will do a really, really good job at making the people in their advertisements look like they are very happy with their life in order to attempt to lure more people in. Another strategy used is the referral from health professionals. A lot of times all it takes is a doctor or another healthcare provider telling an individual that they need to become more physically active, whether it be for physical health reasons or mental health reasons. Another strategy that is often used is a reward system with goal setting. Doctors or personal trainers use this tactic daily in order to keep individuals on task, as well as giving them a sense of accomplishment within their task. The last example listed is to simply outline the benefits of exercise to an individual in order to increase the exercise population. Once some individuals see all the benefits that are available to them, their behavior changes to a more positive one in order to obtain a more healthy lifestyle through exercise. In conclusion, we found out that health behavior, or behavior in terms of exercise and health, was seen as a combination of things that we learn, things that we do, and the attitudes or behaviors that we have towards these things that help us to motivate the actions we take in order to have a healthier lifestyle, both physically and emotionally. We also discovered that there was indeed a correlation between having a heightened knowledge of health benefits to having a positive health behavior. In other words, those who have a higher knowledge of what is needed to have a healthier lifestyle or healthier or more positive behavior are normally those who are better at goals and actually achieving them. We also discussed within the PowerPoint presentation the advantages or positive effects of being physically active in order to promote a behavior change. We were able to see that being physically inactive was seen to be correlated with depressive-like states or negative behavior, as well as increasing the risk of death at a very young age due to either diseases such as cardiovascular disease or due to poor mental health, i.e., depressive-like states. We discussed the two models that are mostly used these days to interpret behaviors. Those two models were the trans-theoretical model and the health belief model. We were also able to touch on the subject of how exercise is being encouraged in order to obtain a more positive health behavior in an individual.